Hello everyone, welcome to have experimental class of pharmacology. This is the first class. So during this experiment, you first study basic operation on animals. During your experimental class of pharmacology, the common animals are rabbit and mouse. And this time, you will do some experiment on mouse. So you mainly study basic operation on mouse. And the second part this time is about it's one experiment. Actually, it includes 3 experiments about factors affecting drug effects with mouse. Basic operation on mouse. During experiment, you should observe what the changes occurring on the animals are. And after the experiment, it is necessary to compare the changes caused by experiment with those before experiment. And mostly, you should compare differences in different animals with different disposals. So you must know well all the animals on which what you have done is respectively. However, these animals, like these mice, they look much similar. It's so difficult to recognize them. So before you administer drugs to them, you should mark them and give numbers to them. So first let's study how to give numbers to mice. Please watch this video. How to give numbers to the animals. For the mice, rats, and rabbits, the yellow picric acid solution is often applied on the different parts of the animal's body to give them numbers. For example, to give numbers to 10 mice, the neck, waist, and buttocks of a mouse can be divided into 9 parts according to the left, middle, and right. You can give number 1 to number 9 to the mice by marking yellow point on these different parts. The remaining one should be marked with nothing, so it's the number 10. Notice, if just there are 2 mice to do experiment, for the number 2 mouse, it doesn't mean to mark 2 yellow points on the body of the mouse. It just means you just apply picric acid on the different local area from the number 1. So this is number 2. Are you clear? And this is experimental class of pharmacology. So every experiment class, you need to administer drugs to the animals. Before you administer drug, you should hold them. So how to handle mouse? Actually, there are 2 methods, one hand and double hands. Now, watch this video. There are 2 methods, single hand and double hand method. Double hand. Put the mouse on the cover of the mouse cage or other rough surface. Lift the mouse tail backwards with your right hand. When the mouse holds the rough cover with its forelegs, you can pinch its 2 ears and neck skin with your left thumb and forefinger. And then clamp the mouse back and tail with your middle finger, little finger, and palm. Single hand. Only use your left hand. Pinch the mouse tail tip with your thumb and forefinger. Clamp the tail base with palm, little finger, and ring finger, and then pinch its 2 ears, neck, and back skin with thumb and forefinger. Double hand method is easy to learn, while single hand method is good for quick operation. Okay. Handle them by the correct method. It can help you to avoid being baited by them. You know, the mouse is very common during experiment. Even after graduation from our university, maybe you want to get a master degree. You need to do some medical research. Mouse also is very common animal during your experiment. So please watch it again and watch it carefully how to handle the mouse. There are 2 methods, single hand and double hand method. Double hand. Put the mouse on the cover of the mouse cage or other rough surface. Lift the mouse tail backwards with your right hand. When the mouse holds the rough cover with its forelegs, you can pinch its 2 ears and neck skin with your left thumb and forefinger, and then clamp the mouse back and tail with your middle finger, little finger, and palm. Single hand. Only use your left hand. Pinch the mouse tail tip with your thumb and forefinger. Clamp the tail base with palm, little finger, and ring finger, and then pinch its 2 ears, neck, and back skin with thumb and forefinger. Double hand method is easy to learn, while single hand method is good for quick operation. Okay. How to administer drug to mouse? You can use different rules of administration. During your pharmacology theory class, you have learned several rules of administration. They have different advantages and disadvantages, and they are used in different situations. Do you still remember them? And do you remember when you study administration rules? Maybe if someone remembered when you study absorption, because rules of administration often affect the rate and extent of absorption of the drugs. So different rules of administration will affect the maximum concentration of the drug in plasma and the peak time, Tmax and Cmax. Do you remember these pharmacokinetic parameters? If you forget, please review. Now, the administration rules for the mouse. It mainly includes intragastric administration, subcutaneous injection, and muscular injection, intraperitoneal injection. Because mouse, the body is very small. During your experiment, intramuscular injection also is very rare. So mainly today you study intragastric administration now, and subcutaneous injection and intraperitoneal injection. The intragastric administration, these rules of administration, it is the same as the oral administration for humans. It also is common. Now look at this video. Oral administration. Gavage method for mass. Oral administration. Gavage method for mass. The gavage injector needle is about 4 to 5 cm long, and its diameter is about 1 mm. Hold the mouth with your left hand and make mouth neck straight, and the abdominal part face upward, and the abdominal part face upwards. While controlling the gavage injector with right hand, and insert the gavage needle into the mouth's mouth along the roots of mouth angle, and press mouth's height with gavage needle in order to make the mouth and esophagus line up. And then insert slightly the needle into the esophagus about 2 to 3 cm along the upper palate. When the needle reaches about the diaphragm level, you would feel a little resistance. And if there is no abnormal respiration, you can inject the drug into the stomach. If you feel a big resistance, or the mouth has abnormal respiration, then draw needle out and insert again. If the needle is inserted mistakenly into the trachea, the injection of drug would induce mouth death. After injection, draw the gavage needle out. The insertion should be gentle to avoid injuring esophagus and diaphragm. The administration volume is about 0.1 to 0.25 milliliter per 10 gram body weight, no more than 1 milliliter. Gavage method. Okay, subcutaneous injection. Subcutaneous administration. To mass. Usually, the injection site is the back of the mouth. You can pinch up the mouth's dorsal skin with your left thumb and middle finger, and press the neck skin with your left forefinger to make this part to form a triangular fossa. Pierce the needle under the skin at the triangular fossa with your right hand, and gently swing the needle to make sure that the needle is under the skin, and then inject the drug solution. After taking out the needle, you can press the injection site with your left forefinger to avoid the drug flowing out. When you administer the drug to a large number of the animals, you can put the mouth on the rough surface, and pour the mouth tail with your left hand, and pierce the needle into the subcutaneous tissue of its back, and then inject the drug solution. The administration volume is about 0.1 to 0.3 milliliter per 10 gram body weight. Yeah, you know, the body of the mouse is very small, so like intramuscular injection. Intravascular injection for mouse also is very difficult. Intraperitoneal injection is much common because the omentum and mesentery are full of capillaries. After intraperitoneal injection, the drug can be absorbed very quickly from the abdominal cavity. So, let's study intraperitoneal injection. It's very common. It is secondary to the intravenous injection. So, during experiment with mouse, intraperitoneal injection is very common. Now, how to do this? Intraperitoneal administration. Intraperitoneal administration to mass. Use your left hand to hold the mouth with its abdomen facing upwards and head downwards, and insert subcutaneously an injector needle into the inferior abdomen either from left or right side at an angle of about 45 degrees. The depth of injection is 3 to 5 mm. The usual administrative volume is 0.1 to 0.25 milliliter per 10 gram body weight. Okay, the pharmacological effect caused by the drug is often determined by the drug dosage. So, we should administer the drug correctly. Try to keep the right dosage in the body of the mouse. After experiment, it is necessary to kill the living mice after experimental class, because the mice are kept for scientific research and experimental teaching. So after experimental class, these mice cannot be used for other experiments. And in order to reduce the pain of the mouse and meet to the requirements of animal ethics, you should learn how to kill them correctly. The method for the mouse is a cervical dislocation. Now, watch this video. Cervical dislocation is suitable for mouse. Press the mouse head with one thumb and forefinger or a nipper. Pinch the mouse tail with another hand, and pull the tail upwards till cervical spine is dislocated, and death occurs. Okay, this is the first part.